Good morning, MJ. Good morning, everyone. Good morning, Dr. Tina.
Hey, good morning to you too, Dr. Chris, and good morning, MJ. Thanks for welcoming us on today's Zoom. This is a little bit different than what we've normally done, and we've talked so much about our flagship product, which is TeleYouth, and we know that we need to truly talk about this product, and it's Surrean Skin Serum. So thank you so much for coming on today. We're excited about this serum. The ingredients in this serum, both Dr. Chris and I have been using for years. This is the go-to to actually rejuvenate your skin. And why do we need to address our skin? Well, first of all, it's the largest organ of the body. When you look at somebody and you see this beautiful skin that they have, remember, our skin is a mirror to our inner health. So it's not only important for our appearance because we all want to look younger and more vibrant, but our skin performs so many essential tasks for our body. It protects our body from all the viruses and bacteria that we are exposed to daily. It also protects us from those EMFs. We've talked about these, the electromagnetic frequencies. It also protects us from the sun's rays, and specifically the ultraviolet light that can damage our cells. When our skin is exposed to the sun, it creates vitamin D, which is so important. We need our vitamin D for so many body functions. Healthy skin helps our body keep its temperatures at a constant level. And here's something we've been talking about with TeleYouth. The skin supports the life of all of our other body parts, and it plays a huge role in maintaining our immune system. So let's look at our skin anatomy. I want you to just kind of take a look over here on the left. Our skin consists of about 3 layers: the epidermis, the dermis, and the subcutaneous layer. The epidermis is that paper-thin outer layer of the skin, and it contains those cells called melanin. We've talked about melanin before, and that's the pigment that gives skin our color. So our skin color is determined by the amount of melanin that we have in this layer. The more melanin, the darker the skin. And the melanin is so important with protecting us from those EMFs. Then we have the dermis. When we look at the dermis, you can kind of see it goes into the middle section of our skin, and it contains all the blood vessels, the nerves, the hair follicles, the sweat glands, and the oil glands. And it makes up about 90% of our skin's thickness. And this is where the collagen and the elastic fibers give our skin the strength and elasticity. And then we go into the lower layers, this subcutaneous tissue here in the lower level. And this is the deepest layer. It's mostly composed of fatty tissue, and it does contain blood vessels and nerves. And this is the fat that insulates the body from extreme heat and cold and provides cushion to protect the body from potential injuries. Dr. Chris, do you have anything to add here?
I think it's great to show this complex anatomy of the skin. And, we always talk about we're energy beings first, and the skin is full of photoreceptors. So energetically, it's designed to take in the energy that's coming into the surface to make the vitamin D and to expose, tell the rest of the body what kind of environment the body's exposed to. So there's an energetic dynamic as well. So very, very interesting.
Mm-hmm. Well, what happens to our skin? We have this outer layer, or the epidermis that I mentioned, and this consists of the cells that are always flaking off or washing off. And these are constantly replaced by new cells and they're manufactured in the lower portion of the epidermis, but then they move up and outward to the outside layer of the skin. So as they move up and out and push up out further, that's when the cells harden and die off. And this cycle of cell production, when you look at this, babies, 2 weeks, this is moving very rapidly throughout the baby's skin within 2 weeks. And that's why you see all this beautiful, vibrant, healthy skin. When we hit our teens and 20s, that declines to about 4 weeks. When we hit our 30s and 40s, that declines, that cell turnover, about 8 weeks. And when we are ages 50 and up, it goes about 12 weeks for all of this cell rejuvenation to happen, that those cells turn over. And that's when we start to see, you know, the weakening of the skin, you know. And think about it, you know, people go, well, why would I want to even, you know, protect my skin or rejuvenate my skin? Again, I mentioned earlier, our skin is a mirror of what goes on in the inside. And think about it, our face is the #1 exposure to the elements of the sun. I mean, we'll wear long sleeve shirts, long pants, but our skin, our face, and our hands tend to be what really takes a beating from the sun and all of the elements when we're looking at trying to protect our skin. Dr. Chris, do you have anything to add?
No, that was great.
Okay.
6 times longer when you get old to regenerate.
And the good news is there is a way to slow this and reverse this 12 weeks. And so, Dr. Chris, I'm going to have you jump into that part of the conversation.
Exactly. And this is really the secret behind Surrean. It's the oligopeptides, the first ingredient you'll see in Surrean. And these are signal molecules. They're proteins that are very specific. They're small enough to be absorbed by the cells, and they're very powerful proteins, some of the most powerful proteins that the body can make. And Surrean's oligopeptides are specifically designed for that skin anatomy that Dr. Tina just reviewed with you. So, you know, those millions of blood vessels, the nerve fibers, sweat glands, sebaceous glands, hair follicles, all of those different parts of the skin anatomy require proper signaling. And most of the time we talk about proteins as building blocks, and you see that in our teleyouth formula. We have the marine collagen. So those peptides, those proteins are used to repair and strengthen, you know, the connective tissue, but these specific proteins are used to signal throughout the anatomy to help it regenerate. So you see, this is how the anti-aging and anti-wrinkling happens, because it improves the ability for the cells to regenerate and repair. So very key, very important to understand the signaling dynamics that happen. Next slide, please.
Yeah, and if I could just give a little bit of a comparison. So people will ask, well, what is the difference between teleyouth signal molecules and your Surrean youth serum signal molecules? Without getting into the science of it, I want to get really basic here. When we ingest teleyouth, they are signal molecules that your body is going to direct to create the balance inside the body. And when we apply Surrean, it's more of a laser beam focus. So wherever you apply it is where it's going to go to work specifically in that area.
Okay, so we talked about how as we age, the skin has a harder time to replace itself. And that's because so many of different factors start to break down. So As we age, the signaling process breaks down, but so does the ability to make the ceramides that maintain the moisture, the antioxidants, the antimicrobials that the skin produces for its protection. And all of these components are in the Surrean Youth Serum to regenerate and recreate these specific, we call them nutrients because they're all very safe and designed to help protect the skin. So the changes that you see with aging can actually be reversed. So we see the wrinkles go away. We bring back the elasticity and the moisture comes back and the skin starts to thicken again because the collagen builds up. And so it's a dramatic process, and the proof is in the pudding. So we'll be showing you some photos here, but Dr. Tina, anything you would like to add here?
Yeah, when we apply Surrean to the top, the epidermis of our skin, it goes deeper into the layers of the dermis. And that's why we see such amazing collagen and elastin regeneration. And then the wrinkles, the hydration, all of that comes back more into balance. So it's so great because when we talked about 12 weeks at the age of 50, our skin is rejuvenating every 12 weeks. When we start applying Surrean, we can reduce that back to 21 days. And so we'll start showing some of those. And our skin loses about 1% of the number of regenerating cells and 1% of its thickness per year. We accelerate our aging when we have excessive sun exposure. We need to have sun exposure. We need to have it during the right times of the day and not so excessive, because studies are showing that when we're having that excessive sun exposure and our skin is damaged by the sun, it has 35% fewer blood capillaries than normal skin. So it's going to receive less nutrients. It's going to receive less oxygen than normal healthy skin. Okay, are we ready? So look at this.
This is so dramatic to see.
Yeah.
Here's a young baby that was being carried by its mother and in the kitchen, and she was cooking, and she leaned over to pick up something on the floor, and the child's hand actually went into the pot of scalding, I believe, water.
It was oil. It was
oil. And extreme third-degree burns. And the thing about third-degree burns is it always creates scarring. And so when you see that this child was able to regenerate and so fast and with no scarring, scarring is the body's way of making a quick fix, a patch up, when it doesn't have all the materials it needs, all the components to regenerate the skin or any part of the body, to regenerate the tissue. It creates a scar. So it's like a quick fix mechanism. So here you see with the application of the oligopeptides that are used in the Surrean serum, this child was able to not only heal rapidly, but also with no scarring. So that tells you right there that the Surrean provided all the components needed so that the body could heal rapidly, but at the same time, not do it with scar tissue, but do it with healthy tissue. So this photo was just dramatic for me to understand and appreciate the full range of support that comes with the youth serum. It truly is remarkable.
I'd like to add, I'd like to add that the oligopeptides were applied twice daily.
Photos of a young boy. So when you think of this child, their regeneration factors were double what the babies were. So you could say, well, maybe the baby healed up so fast because it was so young and has all the repair mechanisms there. But here's a teen that was able to repair just as fast, again, using the technology. So it shows you that you have that age reversal, factor that's introduced with these specific signal oligopeptides. So Surrean, again, is something that will just, well, Dr. Tina, we refer to it as wound healing technology. It's not just like another skin serum that you see to create moisture and elasticity. It actually was first used as a wound healing substance, and the clinical studies that were first done validate that to show how it can repair and regenerate under any circumstances.
Yes, wound healing. And we knew that when it was capable of doing that, it could help us even if we didn't have a wound. So
here you have another type of wound that's again, an older individual, and the harder surface of the inside of the hand, and again, dramatic healing. And one of the things we want to share with you is that the fact that this does repair the tissue so rapidly because of all the components in the Surrean Youth Serum is that the only type of wound that you wouldn't use it on is a puncture wound. And that means that if an individual, has a deep penetration into the tissue, because think about it, if it's going to heal so quickly, the surface might heal over before the internal dynamics of the puncture wound are repaired. So this is a surface wound, and you can see the dramatic, again, turnaround in just such a short time. So after the third application here, is just within hours, you see the changes in the tissue, the inflammation, and
this is in 24 hours.
The tissue integrity totally changing, and showing the rapid response that when the body's given what it needs, it knows how to heal and repair itself. And that's our technology.
Great. I love this photo. Now, she did not have a wound. However, this is a woman that I personally worked with, and she lost a lot of weight, over 100 pounds. And so it was frustrating for her because you can see on the before picture, she was excited that she lost weight, but she didn't like the fact that her skin was sagging. And she only put the serum on. The reason why the photo is from the nose down, that is the only place that she initially applied our serum. And this is so fantastic because she's in her 60s. So her skin renewal is 12 weeks. But look at what happened after 19 days. This is a person who truly was not wanting to use the serum. But then when we explained to her that when you have healthy skin, it's a sign of health inside as well. So why not work from the inside and the outside? So this is just incredible. She did not have surgery. These photos are not retouched. They were taken the same time during the day, same angle, so close to each other, 19 days. So think about it, she was able to push her renewal time to 19 days instead of 12 weeks by applying the serum twice a day, once in the morning and once before bed with a very clean, cleansed face. Here's another client of mine that I worked with as well. And she was being teased by her teenage son saying, "Mom, why do you have a turkey neck?" And she did not realize that, she just never really paid attention to the skin on her neck. And she did not go through a weight loss program, but she just said, well, I think it's probably time that I do something. So she's in her 60s, and you can see her before and after, and incredible. After 21 days, look at the renewal, the tightening that had happened. Just incredible.
You know, the loose and crepey skin happens just on the arms and hands, and not just the neck and face. So you can apply it there. It works anywhere on skin surfaces. Here's another case of discoloration in the skin. And oftentimes, this is a condition that can be diagnosed as vitiligo that has its roots in an autoimmune issue with the skin itself. So the skin has these cells called melanocytes that produce the melanin that Dr. Tina introduced when she was going into the skin physiology. And so these melanocytes lose their ability to produce melanin in certain parts of the skin, and you see this discoloration. And that's not that uncommon because the skin takes such abuse to the surface, and it isn't cared for the way it should be. And so you see this kind of breakdown. It's like a breakdown in its own immunity, its own ability to heal and repair itself. So what you see again, because the oligopeptides in Surrean Youth Serum are designed for just total rejuvenation, you see that the skin, this is a wound that has the ability to repair itself and regenerate. So the color comes back, and it's where skin's darkened because of aging, it can get lighter, and when skin loses its pigmentation, like in this case, it'll actually bring it back. So it's ideal for regenerating the tissue with any type of health issue, as far as whether it's a trauma to creating a wound or if it's a chronic condition that degenerates over time.
And I believe there's no cure for vitiligo.
Correct.
And so this was a true experiment for them, and the results are really pretty remarkable here. Okay, so this is a person from Minnesota, and you can see he went to put water on a sauna, and so the steam just bursted up around his arm, and look at these burns. So on day one, this is 10 days after this first photo, he didn't get the oligopeptide serum until 10 days after the incident. So that 10-day mark, you can see his arm is still pretty raw there. And he was applying the oligopeptides twice a day. Then on day 4, he was still applying it twice a day. And look at the changes in day 7, 1 week later. And you can see that there's very minimal scarring that happened. Again, what happened? It took his skin renewal factor. Now he's in his 70s. Took his skin renewal factor from 12 weeks or longer and started to reduce it down to about 21 days. And I wish I would have had a picture at day 21 to see what had happened, but this is just so remarkable to see these changes.
And Dr. Tina, again, it shows that after 10 days how slow the wound was healing, and as soon as the serum was applied, it just dramatically sped up the whole process. So it's a great testament right there.
Yes, exactly. And now here is a person this is the person that I showed you earlier who lost a lot of weight, and we had the picture from the nose down to the neck, and she had some skin removed from her arms because she had lost so much weight. And without getting her doctor's permission, she decided on her own that she was going to apply the serum directly to her wounds. And you can see when she used 1 pump a day, what happened on one arm, and when she used 2 pumps a day on the other arm. What a dramatic difference in the look of the scar, the healing of it, and how different. I mean, just incredible. So you can't use too much of it. The most I've ever had somebody use it is about 4 times a day, and that's when they have like a diabetic wound or wound that just won't heal. It can be used for that as well. And it's also incredible for sunburn. If somebody has sunburn, it's okay. It's actually recommended to go ahead and use the Surrean Youth Serum, again, because it's a wound healing technology. You can use it on sunburn as well. So let's take a look at our summary of our Surrean Youth Serum. There are very high level, in other words, they're high level and they're efficacious, and there's a lot of them in our youth serum. And it does work at reversing the aging process, rejuvenating, and it stimulates the skin's own renewal mechanisms. It also increases hydration, promotes the elimination of toxins out of the skin. It improves elasticity and resilience. It restores the photo-aged skin. And that's really lots of sun damage on the skin, you know, like hyperpigmentation. It increases the skin firmness. It reduces the appearance of fine lines and wrinkles. And it also balances skin coloration. And you saw all of that with the visual testimonials that we showed you. Now, you don't have to use this. If you have issues, you don't have to just use it for that. What I do is I use it for preventative, because if we can keep our skin cells turning over at a more rapid pace, then we're going to continue to have that more beautiful, radiant skin come through. And people ask me all the time, why does your skin glow? What makes your skin glow? And it is the combination of the Surrean and the TeleYouth. They're just fantastic, working from the outside in and the inside out. Dr. Chris, do you have anything to add before we jump into our disclaimer?
Before we wrap it up, Dr. Tina, maybe you want to give just the recommended application, but I want to just share one closing thought that most of the skincare products that are out there, the beauty creams and skin serums, they often contain a whole cocktail of toxic chemicals, you know, the parabens, the phthalates, the artificial fragrances that are in there. And they actually accelerate the skin aging. And when they're absorbed in the bloodstream, they can often cause damage to the other organs. So just be careful and realize that you have something very unique and special here that reverses the aging process and rejuvenates. And
Great.
can we give the recommendations of how to use it?
Absolutely. So let's talk about optimal results. First of all, you want to cleanse your skin, pat it dry. If you use toner, make sure it is a toner that does not have alcohol in it. Alcohol, number one, is going to dry your skin, but the other thing it's going to do is it's going to damage the live oligopeptides that you are now going to apply next with your Surrean Youth Serum. So if you do use a toner, go ahead, let that dry. After that's dry, apply your Surrean serum. 2 pumps, morning and night. So it's 4 pumps a day, and that should last you anywhere from probably 4 to 6 weeks. And so I use this twice a day. After you put your Surrean on, once it dries, that means it's penetrated into the skin. If you have very, very dry skin, or live in a very dry climate, like Dr. Chris, you live in Reno, it's very dry there. Or for those of you in like Arizona, the desert, you might need to use some kind of a moisturizer. You will find, though, that you'll need less moisturizer as you start to use the Surrean, because remember, these oligopeptides, they actually help your skin to hydrate itself. And most children, they don't put moisturizer on their face or their skin. They have pretty good, healthy skin. So when you start using the oligopeptides with Surrean, you're going to find that your renewal factor is going to go from 12 weeks down to maybe 2 weeks, 3 weeks. And you're going to see that eventually you might not need as much moisturizer in those areas. So that's it. It's very easy to use. If you use other serums, ladies, we tend to use a little bit more serums. But if you do use them, always put your Surrean on first. Let it dry and then layer over the top of that.
That was great. Thank you, Dr. Tina. So thank you everyone for joining us today. Again, this presentation is provided for informational and educational purposes and is not a substitute for any type of professional advice. It's not intended to diagnose or treat or of any form of ailment. And so we strongly recommend you work with your healthcare provider and professional. And thank you for joining us.
Thank you.